Hello, my name's Melissa Salas. I'm going to start my competency right now. I have my competency up and everything else put away so I can get started on that. I'm going to go ahead and start with question 1. And so describe the location of the following equipment or supplies, which is the professional medical kit, the eye wash station, the fire blanket extinguishers, and let me see, the student emergency kit. Let me make this bigger font, sorry. Okay, so the medical kit can be found as soon as you walk into the operatories. You turn right, and every day we have our key that we make sure we open up that cabinet, and it contains, it's a filing cabinet. It's in front of Op 1 and 2, and it contains all of our medical emergency kits in there. And then the eye wash station, there's one located in the lab. There's one located in the sterilization room, and so basically those get checked daily to make sure that they're not expired or that they're clean and that they are working and functioning. Let's see, the fire blanket, that one is located under the materials lab cabinet. It's in a yellow kind of like, it looks like a refrigerator, but it's like a yellow cabinet it keeps it there. And then the fire extinguisher is located, there's a few located, there's one in the materials lab, and then there's one hanging right there by the it's the materials lab and the sterilization room, so there's 2. And then the oxygen tank, those are also in front of Op 1 and 2 when you first walk in. Those can be found there with the nitrous tanks too. And there's all the sizes of the masks are up there for every size of, from pediatric to adult, basically is all ours have. And then we have the nasal cannula, the bag mask. And so, let's see, and I think, the student emergency kit is in the, that one's in the filing cabinet on the top, on the left, on the top of Op 1. So the same location pretty much as all the emergency stuff. And then for the next question, name 5 ways that the clinician can prevent a medical emergency or recognize a medical emergency in the early stages. So basically this is going to be done right away. When you take your patient's vitals, when you seat them, you want to just be aware, especially patients that aren't new patients, you'll be able to tell if they're looking like themselves or looking normal. You'll kind of have a medical update on them. And then patients who are new, you want to already have gone through their medical history the day before or hours before they get there, and you want to just make sure that they anything on their medical history, whether it's heart conditions, allergies, anything like that, you want to prevent any other medical emergencies, as far as like if they're allergic to anything. Discuss what types of anesthesia they've had in the past, and just kind of being aware of what types of anesthesia they can have. And if they do have an allergy, if they carry an EpiPen with them, check to see if they have one, and make sure that it's not expired. Make sure that they bring it with them to every visit. And just discussing like if you want to use epinephrine or you don't want to use epinephrine. Just a plain, if they have heart conditions, and they come in with elevated blood pressure that's like elevated but normal for them, you can use the plain. And then you want to establish a really good baseline of vitals for them. Like I said, if you've seen them before, you could make sure that those are like what their vitals are normally at, and if not, then you want to take the vitals. If they're elevated, you can wait 5 minutes and try it on the other arm, and just make sure that, you know, they're in that baseline range. And then the third one could be, you know, making sure that all of the medication, the medical cabinet is up to date. Make sure that everything's in there. Make sure the cabinet's unlocked. Make sure that nothing's expired in there. Everything's fully stocked. Making sure that the oxygen has, you know, plenty of oxygen. Make sure that none of that is, you know, faulty with any of the hoses. And then, of course, keeping up with your CPR trainings, things like that. And then the fourth one could be, I think, just kind of keeping up with your with all of your credentials, you know, making sure that along with the CPR you're doing trainings like the medical emergencies class, and just kind of keeping up to date with what anesthetics, you know, are working and what you can use, things like that. And then you always want to look at the patient, and know what the early signs to anything is. You know, if they're pallor, if they're breathing, if the respirations are elevated, just kind of making sure that they don't have any kind of like abnormalities with like a droopy eye or feeling weakness, or you know, any signs of just something not being quite right. Okay, question 3 is describe the importance of stress reduction protocol for patients. Give examples of stress protocols. So one importance is to kind of keep everything, keep them calm, you know, talk to them in a calm voice, making sure to communicate, give eye contact, making sure that you know what their vitals are, and making sure that, you know, there's not going to be one thing that causes the other. So like if they're high anxiety, then they could start to hyperventilate. If they have hypertension, they could start to have more elevated heart rate. When patients come in anxious, especially during like a procedure, like if they're going to get anesthesia or anything, then basically you just want to make sure that they're informed, that you give them all the information they need, and just always being calm and talking to them in a calm tone. Number 4, list the steps to take when an emergency situation occurs at DACC. Basically, let me read that question again. List the steps to take when an emergency. So you always want to make sure that your patient's in the correct position, no matter what. Like for certain situations, for seizures, things like that, you want to keep them laying down. You want to keep them supine, and or laying down. Yeah, so you want to keep them laying down. And then for patients who are hyperventilating or having any issues with breathing, you want to sit them upright. And then basically for infants, you want to look around, you want to assess everything, you want to make sure that you're keeping track of their vitals, especially if you can keep them monitored on their vitals, that would be great. If you could take them every, 5 to 10 minutes, that would be good. You want to check for responsiveness. always have someone call 911, look at them directly, point at them, and make sure that they know that they're the one that's going to call 911. Don't ever leave your patient in the room by themselves. You want to get a faculty or, you know, another student to call the faculty and make sure that you don't leave your patient at all. You want to get the AED, and you want to get all of the medical equipment that you're gonna need, whether it's like an EpiPen, or if you feel like they're having like an allergic reaction, you can make sure that they have that. You can get them the nitro glycerins if they're having a heart attack. Some patients actually carry it with them, so that's kind of nice too, to make sure that, you know, you ask those questions prior to. And then just basically communicating with the whole like anybody who's around, you know, communicating and calling 911 and activating EMS as soon as possible. If the patient stops breathing, you want to start compressions right away. And if they don't have a pulse, you want to start compressions. You want to do 30 compressions, and then you'll want to use your you'll want to check for their pulse, and then you want to always just kind of just check. That's for infants. You want to just use the chest compressions with 2 fingers, and it's the same for all ages, so you'll just use the 2 fingers for infants. And then for children, it could be you could use 1 hand to do your compressions, and you want to make sure that your elbows are locked and that your compressions are the correct depth. So for it should be about 2 inches deep. And then for adults, you want to do the same thing, assess the area, check them for a pulse, call 911, and then you want to do you could do the 2 breaths also, but it's 30-second compressions with 2 hands, and you want to make sure that you're giving, you know, good compressions and not, you know, just barely pushing down on their on the area where you give the chest compressions. And then for number 6, explain the difference between the 1 rescuer CPR and 2 rescuers. So when there's 2 persons, one does the breathing and then the other one does the compressions. And then basically you guys can switch, where the one, you don't have to do the breaths. You can just continue doing the compressions as needed. And then number 7, list all medications and their indications that are found on the professional emergency kits. So we have let's see, that was number 7. Okay, so list all of the medications. It's going to be the nitroglycerin that I just talked about, and that one's going to be for acute angina and myocardial infarction. Anybody with, you know, a history of heart attacks or heart failure. You want to, oxygen is another. You want to use it for almost every single emergency except for like hyperventilation. And then the epinephrine, you want to use the yellow for adults and green for children, and always check the expiration dates on those. We have the diphenhydramine, which is for an allergic reaction. It's an oral medication. It's similar, well, it is like Benadryl, and so you can give the patient that depending on what kind of allergic reaction they're having. You can administer albuterol for any kind of asthma attacks, and aspirin if they're having any chest pains or feeling any tightness in their chest and they have a history of heart attack. You can give them that. There's the oral carbohydrate, which is for hypoglycemia. Basically, it's gonna just elevate their sugar levels and get them back to a normal level. Of course, monitoring the blood glucose levels at all times, or just if they're there and you know, and you get a baseline, then you can check them. If they're having hypoglycemia, you could check it again after you give them the oral carbohydrate. And then there's an injectable benzodiazepine, and it's for that one's for the seizures. And then the corticosteroid that can help for any kind of like anaphylactic reaction. It could be used for adrenal crisis. The glucagon is for hypoglycemia or when they're unconscious. And then number 8 is going to be describe how, my mouse is kind of crazy. It just moves everything quickly. Okay, so number 8 is going to be describe how vital signs need to be recorded during an emergency situation and explain its importance. So vital signs should be documented every 2 hours when there's something abnormal, and every 4 hours when they're stable. And so this will give a good baseline. Again, you could take it before the 2 hours, but that's like the least amount that you want to wait, especially in an emergency situation. And then number 9, recognition of airway obstruction. Describe the signs and symptoms for partial obstruction or complete obstruction. So partial, pretty much they're still breathing and they're still able to, they may or may not be able to talk or gasp or anything, but they're coughing, their color kind of turns. They could start turning bluish. A lot of times they'll do the universal sign for the choking, which is the 2 hands. Sometimes you'll hear them wheezing. You'll hear them just stop breathing, and then they'll feel anxious or they'll feel fearful. You can see it in their eyes when their eyes are opening big. And then complete is basically they're not going to be breathing, so they're going to probably be passed out. They're going to be more distressed. They're going to be gripping at their throat. They're going to have a really blue color in their face. And at that point, they're not going to be talking. More than likely, they're not going to be coughing. Number 10, explain the use of the Heimlich maneuver and describe its technique. So the Heimlich maneuver has been known to save lives. And so it does save lives if you use it properly. So you want to use this when there's a total airway obstruction. It could help if the patient's breathing and they have a partial obstruction, but you can tell that they're in distress and that you can help them. You want to try starting with the Heimlich maneuver. And then basically you're just doing the thrusts underneath the sternum, or not the sternum, the right above, right underneath, like where the breastbone is. And you want to just go in an upward motion, and you want to thrust that until the object is expelled. Okay, and then so for number 11, it says identify the, number 11. Identify the oral pre-medication regimens for adults and children for patients allergic and non-allergic. So basically the allergic dosage for, if a patient is allergic to penicillin, you want to give them something that's on a different class. And so it's going to be the cephalexin, and that can be 2,000 milligrams. it can be it's going to be 1 hour before the procedure. So that's going to be their pre-medication. And then for children, you could do the 50 milligrams. And that one's also 1 hour before the procedure. And then for the other medication, you could use the doxycycline. And that one is 100 milligrams 100 milligrams 1 hour before the appointment. And then for a child who's under 45 kilograms, they could use or the 2.2 milligrams per kilograms. And then the if they're over 45 kilograms, then they can also use the 100 milligrams 1 hour before. So if they're not allergic, the main one that a lot of dentists will even have in their office is the amoxicillin. And that one is the 2,000 milligrams 1 hour before. And then for children, it's going to be the 50 milligrams 1 hour before. And so question 12, name the signs and symptoms of respiratory failure. Explain medical emergency procedures. So they're going to have a patient that's in severe respiratory failure. They're going to have severe hypotension, and then they're not going to be able to breathe. They're going to have dyspnea. And then the emergency situation for that is you want to sit the patient in the supine position, contact EMS, perform the ABCs of CPR, and then monitor vitals. You can put them on 4 to 6 liters of oxygen to help keep them from, declining. And then number 13, name the signs and symptoms of hyperventilation, procedures that need to be performed. So they're basically not going to be able to, when they're hyperventilating, they're going to have problems with their motor skills. They're going to be off balance. They're going to not be able to perform certain tasks. They're just going to be kind of out of it. They're going to have problem solving impairment. And then basically you want to stop the procedure like right away as soon as you can, and make sure that you sit them up, and that if the patient wants to lay down, they can lay down, but you want to try sitting them up so that you can calm them down and you can get them to start breathing. You want to loosen anything tight from their neck. You want to have them breathe in through their nose, out through their mouths. They could oftentimes some of them will want to breathe with their cupped hands, or they'll have pursed lips, and that you can do some counting with them. You can make sure that they're just kind of just calming down, slowing those respirations, not panicking. A lot of times they'll tend to panic. And so number 14, name the signs and symptoms of syncope. Explain medical emergencies that need to be performed. So they're going to be loss of color. They're going to be really pale. They're going to have tachycardia, which is the high heart rate. They're going to be oftentimes they'll have cold hands. They'll be yawning. They'll have hypotension. Bradycardia is even possible. It just kind of just depends. Many times they'll have like nausea. They'll have visual disturbances. They'll lose consciousness. And so you want to stop the treatment, remove all the objects from the oral cavity, make sure that they're sitting up or laying down even in their supine. So for this one, you want to make sure they're laying down in the supine with their feet elevated, so that way they make sure that they're not off balance and they're not going to fall over. You want to remove their tight clothing from their neck, like I said. You want to do 4 to 6 liters of oxygen. You could do, if they're experiencing severe like bradycardia, you can do the 0.6 milligrams of the atropine, and but that's like an IM injection, and sometimes you can just make sure that you're taking their vitals. You can give them, if they pass out completely, you can give them a pneumonia inhalant. And then if they feel well enough, you can sit them upright, and then you can check their pulse, make sure that their pulse comes back to normal. And then you want to avoid having them scheduled for at least 24 hours. So always make sure that patient has a ride home after any kind of emergency incident. You want to make sure that they're safe when they leave there and that nothing happens. If they don't leave by EMS, they should always have somebody driving them when they leave there. It's just a good thing to do. So name this, number 15, name the signs and symptoms of an asthma attack and explain the emergency. So there's different forms of asthma attacks. There's going to be mild type form where their breathing is kind of like between 14 and 20. And then they can still talk. They're still actively talking. They're still, you know, communicating, but they start to have like wheezing, shortness of breath, of course, and then the chest tightness. And then if it goes to the moderate stage, that's when their color starts to change. Their color starts to get a little, like their muscles are start to be like they'll be coughing, wheezing, they'll have tightness in their chest. They're gonna have respiration rate goes up and gets elevated. It becomes more difficult for them to breathe. Their muscles in their ribs, they have less airflow. And then the severe asthma attack is when their respirations are completely labored. They are breathing either very fast or very slow, and they're in distress. And then they'll have the wheezing, the coughing, the tightness in chest, the their skin color is really poor. It's starting to look, you know, really pale or bluish from loss of oxygen. And then their level of awareness is severely decreased. And so just depending on which type, more than likely you're always going to use like the albuterol, the inhalant treatment right away. It has the fastest onset, and it's usually lasts between 30 and 60 minutes. So the longer durations can last 4 to 6 hours. For pediatrics, you want to only give them 1 puff, and then for adults, you want to give them 2 puffs, and that can be given every 15 minutes. And then if there's a spacer available, that helps to get the albuterol into the lungs a lot better. So a lot of them are very familiar if they have asthma, and they've already been coached on how to use the spacer. So oftentimes they won't have it on them, or, you know, but they do know how to use it because they are coached on it right before they're given it. And then you just want to monitor their respiratory status, maintain their airway, sit them upright with their arms forward, monitor their vitals, administer oxygen 4 to 6 liters, and then EMS will oftentimes, you know, they've already been activated, so they'll be on their way. If it gets to that severe, to where the first one didn't help and the second one isn't helping, you want to activate EMS, and then they'll give sometimes an injection of the epinephrine, and then they'll make sure that, you know, the patient is able to stop the asthma attack, basically. Okay, number 16, name the signs and symptoms of heart failure. Like this. Or cardiac arrest, explain medical emergencies, procedures. So signs and symptoms did not improve. Okay, so this one was for the name signs and symptoms of heart failure, cardiac arrest. So A lot of times when they're going to go through, when the patient is going to have cardiac arrest, they're going to have a lot of chest pain. They're going to be clutching at their chest. They're going to be letting you know that something doesn't feel right. A lot of times they'll say it feels like an elephant is sitting on their chest. A lot of times they'll have the nitroglycerin that can be administered, and then it's best if you feel like they're having a heart attack and they have a history for sure. Activate EMS, and then administer 4 to 6 liters of oxygen and maintain their airway. Check their vitals every 15 minutes, and just making sure to keep a close eye on them. If they stop breathing or they go into cardiac arrest, you want to start compressions immediately, which is the 30 compressions. And then number 17, name the signs and symptoms of a stroke or heart attack. Explain medical emergency procedures that need to be performed. So a lot of times for patients who are having a stroke or a heart attack, they're similar to what we just talked about. They'll hold their chest if they're having a heart attack. If they're having a stroke, a lot of times they can't lift one arm, or their arm goes numb, or their face will look droopy on one side. They'll start to be slurring. They'll have eyelid movements. Their lip is, when they smile, their lip won't go up when they go to smile. They'll have lots of jerking motions. You want to loosen their clothing. When that stops, you want to, of course, stop all the dental activity. Loosen their clothing. And then you want to you want to put them in the supine position so that they don't aspirate. And then lower the chair all the way down to the ground. Make sure that they're, if for some reason they try to get up, or they try to fall over on the lowest level to the ground, gently just restrain them to avoid self-injury when they're having any kind of stroke or losing control of any of their body parts. If they're jerking, if they go limp, a lot of times they can go limp. They can't really think cognitively, and so basically you're just kind of there to support them and make sure that you're giving them like the 6 to 8 liters of oxygen. You want to, start the compressions if they stop breathing, or they stop, their heart stops. And then in order to manage like any of the seizures or anything. Am I on seizures? Let me see, I'm on number 17. Okay. Oh, this keeps moving. Let me move it. I am on number 17. Yes. So name the signs and symptoms of angina pectoris. Okay, let me just number 18. Okay. So angina or angina is basically chest pains, and they're sometimes of unknown cause. Sometimes people just get them, and sometimes they're constant. Sometimes they're just come on, and patients don't know when exactly they're going to come on. So if they start to experience any chest comfort, any type of squeezing, any of the pain radiates down to their arm. They become pale, they become nauseous, they vomit, they have jaw pain, and it lasts, 1 to 15 minutes, then that's a sign that you need to take that way more serious. And so basically you want to terminate the procedure sit them up in a semi-supine position. You want to administer 4 to 6 liters of oxygen. Monitor their vitals. You can give them the nitroglycerin if they have it, or if we, of course we'll get it from the medical emergency kit too. But administer a nitroglycerin, and you can do 3 doses every 1 to 5 minutes. So it's pretty fast. And then, so number 19, name the signs and symptoms of hyperglycemia, which is the diabetic coma, and the insulin shock. Know the difference between the two and explain the emergency procedures. So, let's see. So for hyperglycemia, their diabetic coma, their sugars go elevated really high. And so basically you just want to make sure that you look for any signs of symptoms of them being like, they're not going to be very alert. They're going to kind of be like confused. They're going to have seizures, dizziness, weakness, headaches, hunger. Let me see. They're going to feel like they're hungry. They're going to feel cold and clammy. Sometimes they'll get irritable or aggressive. And then they'll have a headache. And so the emergency treatment for that is going to be in a conscious patient, and they haven't passed out or anything. You want to give them the 20 grams of sugar, or some form of sugar, and then maintain their airway. Make sure that they're, alert and that they're able to talk and everything. If you're going to give them any kind of sugar, if they're unconscious, you want to activate EMS. You can give them the glucagon 1 milligram. You can give it intramuscularly, and then sometimes they'll do, like when EMS gets there, the dextrose. I think it's the IV form, and it's about 20 mLs. 20 mLs of the 50% IV dextrose. Give them the 4 to 6 liters of oxygen. And then the hypoglycemia is they're gonna have poor skin, turgor. They're gonna be warm and dry. They're gonna be thirsty, muscle weakness, fatigue, nausea, blurred vision, tachypnea. They'll also have like those Kussmaul breaths where they're like raspy type breathing, and then they'll have sometimes like a fruity odor in their mouth. And so for that, you want to activate EMS. You want to make sure that you're taking their vitals, you're administering oxygen, and making sure that they're not going into that complete shock. Okay, so I am on what number? I lost my number. 20. Okay, I lost that page. Where did it go? Okay, number 20 is going to be number 20. that page. Okay, so let me see. Number 20, name the signs and symptoms of allergic reactions. Include immediate. Why can't I see this whole thing? Immediate anaphylaxis and delayed. Know the difference and explain the emergency procedures. Okay, so for the anaphylaxis, there's going to be 3 types of anaphylaxis, and so they usually occur within 24 hours. So the 4th type, let me see, there's different. The anaphylaxis symptoms, they usually occur within minutes of the exposure. So basically, if they're allergic to something and they have a severe allergic reaction, they're going to have an immediate reaction. And then they're going to have skin reactions, which can be itching, or it can be pale skin, flushed, low blood pressure, hypotension, wheezing, any kind of weak or rapid pulse, dizziness, fainting. You want to call 911, activate emergency EMS, and then you can give them the epinephrine, the auto injector, if that's available. You'll put that in their thigh. Make sure that the patient is in a laying down position with the legs elevated, and then you want to check their breathing, their pulse, and administer CPR if needed. And then, okay, so number 21, name the signs and symptoms of a seizure, explain medical emergency procedures that need to be performed. So, signs and symptoms of a seizure. So, a lot of times patients come in and they look completely normal, and you would never even think that they're going to have a seizure. I know that because I worked in an emergency room, and it was scary because they would just go into a seizure, and there was not a lot of signs, and so one of the things that you can look for is some kind of like confusion. That's one of the first things that they'll start to kind of look around. They'll start to look kind of dazed, confused. They'll be jerking uncontrollably. A lot of times they'll lose consciousness. They could lose all awareness, like they don't know where they're at. They'll have cognitive and emotional changes. And basically, you want to assess for safety, for sure. You want to make sure that you stay right by their side and do not let them, go. There's not a whole lot like you could do to prevent like them choking on their tongue or anything, because you want to keep your hands out of their mouth. You don't know if they're going to bite down, and it's going to be, it would probably be bad for you if you're putting your hands in their mouth. But basically, you want to let them kind of go through it and make sure you stay that with their chair all the way down to the lowest level. You want to make sure that they, are just not able to fall out of the chair at all. You want to also note the time of the seizure. You want to you try to place them on the floor if you have help. That would be the safest place for them. Remove anything sharp, anything that could fall on top of them. Any loose clothing around them, and their, if they have glasses on, or if they have, a scarf, or they have clothes that could get caught, while they're trying to remove everything away from them so that they're not, doing more harm with that. Try to cushion the patient's head if you can. Once they're stopped having the seizure, you could turn them on their side and try to keep them there and just remain there to support them, and call EMS. Make sure that you're there by their side until EMS gets there. Okay, number 22, name the signs and symptoms of local anesthesia reactions. This includes allergic reaction, toxic overdose, psychogenic. Explain the medical emergencies with that. Okay, so the signs and symptoms of anesthesia allergic reaction. Basically, you're gonna just want to watch to see if the patient's how they're reacting through it. A lot of times it won't be like immediate like as you're injecting, but know and pay attention to what they look like before, how they're acting before, and then immediately after you want to, of course, you know, put your syringe in the safe cartridge, and then, you know, focus in on your patient and pay attention. A lot of times they'll have some issues with breathing. They'll have some kind of like numbness or sharp pain. They'll have you know, some of them can even faint. And so basically you just want to watch for all and any kind of signs for, you know, a reaction like that. And so some of the things that they could get are, you know, they could go into adrenal crisis, where you want to put the patient in the supine position, assess their oxygen. You can put them on 5 to 6 liters of oxygen. Activate EMS, syncope. They can be placed in the Trendelenburg. 5 to 6 liters of oxygen. You can if they pass out, you'll put the crushed ammonia underneath their nose, facilitate for any kind of, you know, if they stop breathing, anything like that. Hyperventilation can be one. You want to terminate the procedure. Bronchial asthma, assist the patient, breathe, help them with breathing, you know, calming their breaths or sitting them upright, making sure that they're able to catch those breaths. If they're having like bronchial asthma, you can administer the albuterol as well. A lot of times if they're having an allergic reaction, their skin is going to look like they could get itching, they can get hives, they can have swelling in their lips, their tongue, their mouth, their face. You want to administer an antihistamine if they have any trouble breathing, respiratory. They're going to have bronchospasms, distress, any kind of wheezing, cyanosis, anxiety, tachycardia, and then basically just administering 5 to 6 liters of oxygen for that. Laryngeal edema with the swelling in the larynx. Basically, you want to watch for any kind of respiratory distress. You want to listen to the pitch of their voice, see if that changes at all. Any cyanosis, any loss of consciousness, activate EMS. 5 to 6 liters of oxygen. You can administer a corticosteroid if needed, and then make sure that the patient gets transferred to the hospital. And then for number 23, let me look over here. Name the signs and symptoms of a hemorrhage or hematoma. Explain the medical emergency procedures that need to be performed. So a lot of times they'll have pain and swelling, disfiguring kind of bruises. Basically, the hematoma, it can come out, you could see it exteriorly or intraorally or extraorally. And so just depending on how severe the hematoma is. And so basically you want to put ice on there, on that area for 10 to 20 minutes, and then you want to just put heat the next day, because that's going to help kind of loosen, make sure that the muscles don't stay locked up and that there's hemorrhaging stops. And then for number 24, name the signs and symptoms of a foreign body in the eye. Any kind of like accident that happens whether you drip something in the patient's eye, which you shouldn't because you should have them wearing the glasses and everything. You want to make sure that anything that's like burning or irritated or feeling that there's something in there, you want to, if their eyes are watery or red or they feel it right away or they start blinking and it feels scratchy, if they get any kind of blurred vision or loss of vision, you want to irrigate that area as soon as possible. You want to have them go to the eye flushing station, and then you want to make sure that they do that. They can do that for up to 60 minutes, but if by then they're not able to see or anything like that, you should have called EMS by at least 10-15 minutes. If it starts to improve within the first 10 or 15 minutes and you're flushing and you can do a 15-minute rinse, and it's better, then you should be okay. You want to make sure that they have a ride home and things like that. But basically, if something after an hour doesn't seem right, you want to call EMS and make sure that they get checked in the emergency room right away. And then for number 25, name the signs and symptoms of epistaxis and the medical emergencies. So epistaxis, that's the nose bleeding. So basically for that, you want to make sure that they you want to see what kind of nosebleed they have. If it's an anterior nosebleed, it's going to be bright red. If it's a posterior one, it's going to be more dark in color. And then basically you want to use the protective. You want to have your gloves on, your glasses, your shield, and shield yourself, because that's, if they have blood everywhere, you want to make sure to just keep yourself safe too. You want to position your patient in an upright position, maintain their airways. So you don't want to have them push their head back, because the blood can go down into their throat and it can cause choking, it could cause nausea, it could cause more problems. You want to just keep them, you can suction some of the blood if you can see it piling up into their mouth at all, but you want to apply direct pressure by pinching the lower part of the nose, and just apply pressure and have the patient just keep their breathing steady, keep their breathing, calm, and breathing out through their mouth. And then you can put an ice pack right above the nose, and that will help to take down some of that swelling and stuff, but mostly pinching that area of the upper nose helps to shut off those the little vessels that tend to bleed up here, up high. Okay, so discuss the importance of documentation in the patient's chart. So this is the patient's chart, and documenting everything, basically just documenting the time that it happened, what the incident happened, exactly step by step, is going to be crucial to any dental hygienist or dentist license, because you want to make sure that you show that you did all of the right things and you took all of the right procedures and precautions to help your patient. Documenting times, documenting whatever was administered, whether it was, if it was 3 nitroglycerin, or if you did how many puffs of albuterol, and just kind of telling a story with your case notes of exactly what happened, step by step. It just helps somebody later on look at the case notes and know, like, it feels like they were actually there, because everything that was on there is so detailed that they feel like they could, replay this in their head of how everything went down and how you handled it. And it promotes safety for the patient. It promotes quality for your practice. It should always be accurate. It'll always pretty much ensure that you provided them with the best care possible, and it was all, streamlined and professional treatment, and that you handled the medical emergency well. I think basically you just want to make sure that you have everything documented so that you could tell the story of what happened exactly, and make sure that the patient got the best quality of care. Thank you.